webinar where we started to talk about wellness visits and how we can really try and build a program for each of you. And I know for many of you this was really kind of building off some of the things that you would have discussed with the PACS ACO and really kind of enriching some of the things that you had already talked about, or a refresher for many of you. Now for today's session we're going to go into a few more things related to well visits, and I would say that today is going to be like a 200 level class. If we're thinking about going back to college and learning about a different subject, where the one we did in February, that was more like an introductory class, and this is producing the topic. Now we're going to be thinking about things more like a 200 level class, or like a second term or a second version of a class. So hopefully by today you'll be able to have a few more tips for taking this thing that you produced and you had an introduction to, and figuring out how can you tweak it, modify it, and make it most applicable for each of your practices. Now we're going to go over some things today that I think are good practices, and I would say that I've seen them work in different facilities. I'm not going to say that any of them are a hard and fast rule or think something that you have to do. I just want to expose different topics and different ways of potentially doing a wellness visit, because from my experience, doing these well visits is one of the most important things you can do for your practice, for not only helping you to be successful within the ACO, but also increasing revenue and better connecting with your patients. So because there's so many different components that are associated with doing a well visit, one of the things that I like to always make sure that we're promoting is how can we really try and maximize those workflows for yourself? How can we figure out some of those nuances and things that have worked well for someone and bring those back to ourselves? How can we think about billing? And I'm going to go back to billing a few different times, because the more successful we are with our billing, the more successful we're going to be with each of our well visits and each of our internal programs well visits. And then how do we make sure that we're setting goals for ourselves, monitoring our performance to ensure that not only have we started this program and really undertaken it, but we're positioning ourselves to be as successful as possible. So to get started, and really kind of that reason or that burning platform for why are we doing well visits? And one of the most important things from my perspective is really engage that relationship with our patients in a different way. And I say in a different way because we oftentimes think about going to the doctors as going to almost like a mini ER, and you go in for something when you're really sick or something that's almost semi-acute. Well, when we're introducing the idea of a well visit, we're going from the idea of it being a sick visit to a healthy visit, or starting to reach out to our provider before we get sick, and hopefully making that connection. Because the stronger we can kind of build that relationship and sticky ourselves with our patients, the more likely they're going to turn to us when something is potentially not going well. And we're always going to be the first call that they make. I know from personal experience that the more successful you are with your well visit program, the easier your quality audit's going to be. Now, I'm not going to guarantee that you're going to be perfectly successful with everyone's quality audit that we're going to do this year, because it will take a little bit of work in addition to just doing our well visits. But when we looked at our Imperium ACOs, and we had a new 2017 starter with us, and this ACO got 80% for their well visits. It was something that we pushed on them right from day one, and they had actually beaten the ACO that was previously #1 for several years in a row, and they had increased their well visit counts from about 30% to about 45% for their whole ACO. And I had had conversations with their leader of that group that was about 30 to 45%, and her takeaway was well visits are important, but it doesn't necessarily close the loop on every opportunity. And that's absolutely true, because a well visit alone will not ensure that you're going to be that you will have closed every quality measure, because it still requires patients to get those mammograms, get that colonoscopy done every so often. But at least by doing the well visits, we've developed a care plan. So these two ACOs were very similar in their overall performance from a quality audit perspective, but I would say the one that got 80% on their well visit probably worked a third as hard as the one that did 45% on their well visits. So just to keep that in mind about, let's make sure that next January, February, March, we have better things to do than quality audits. So the more successful we can be now, the easier it's going to make our quality audit later. And I'd say we have better things to do, because a well visit is one of the highest revenue generating and greatest production associated RVU visit from an RVU perspective visits. An annual wellness visit is 2.43 RVUs. So for any of you that use an RVU model for your practice, that's huge. Most just clinic visits are going to be around 1. And a well visit is also one of the best ways to identify patients that might have other opportunities or other things that could help to generate revenue for a practice, such as chronic care management. because the more we're connecting with that patient and having those healthy discussions, the easier it's going to be to start to uncover things that are going on with our patients that maybe need intervention. May not need necessarily aggressive intervention, but they could benefit from that weekly or monthly check-in that you'd be able to offer as part of chronic care management. So as a refresher from last time, again, an annual wellness visit is not a physical. That's something we're going to get back to a little bit later, but the idea of saying that we're going to go in for our Medicare physical can be a little bit deceiving for patients because they expect that they're going to get this really comprehensive head-to-toe exam that's going to be everything from labs to imaging and who knows what else in between. Some patients even expect a hot breakfast for that. Unfortunately, an annual wellness visit is not quite that. A wellness visit is really an information gathering visit where we're starting to identify those risk factors and starting to identify where there are things that's going on with our patients that we really need to be aware of. And going through and developing that personalized prevention plan for each patient makes such a difference in terms of positioning that patient to be as successful and healthy as possible and really positioning them to thrive independently. So one of the things that we talked about in our last webinar session was a well visit can really be broken down into a couple components, but saying that we're going to establish a well visit program, meaning that we're trying to do it on a variety or on the majority of our patients, that's going to take about 5 steps, and 5 steps to be really successful. Now we want to make sure that our EMR and our clinical workflows are as effective as they can be. That every team member, and I say every team member from a physician to an MA, to the manager, to a registration team member, or to the physician and MA, know the steps of an annual wellness visit and know why it's important, or know the pitch that they need to deliver if giving it to a patient of why an annual wellness visit is important. And there's going to be some information in that well visit toolkit related to how do we best message this to patients. We want to make sure that our billing is being done correctly. We want to make sure that we're being proactive about scheduling patients. And we want to make sure that we're monitoring our performance over time, because if something isn't quite going right, it's always best to nip it in the bud early. Prevent things from lingering or getting worse if there's an opportunity to put a change process in place to make sure that we're able to be a little bit more successful. So with our annual wellness visits, I would say now that many of you have started to introduce those processes or some of the things that we talked about last week, or even started to figure out how can I best adapt this for myself, I would say standardizing your workflows within your organization are going to be a real key to success. Now, when I say standardized workflows, I know that the workflows across clinics within our organization are going to be a little different. For those of you that have one provider, one MA, one registration team member, your workflows are going to be inherently a little bit different than a larger facility. I would say the best thing we can do is really try and break down the annual wellness visits into its true components and identify who can do what. How can we best share responsibility? Now, a phrase that I love and I tend to use a lot is top of capacity, top of credential. So as we're thinking about well visits, not everything needs to be done by the physician or done by the provider. So who has, from a medical perspective, the license or the credentialing capability to do it? And also, who has the time to do it? Because a physician might be able to do the whole visit. They could do everything from asking the patient every individual health risk assessment question to taking the blood pressure to developing a personalized prevention plan. But that might not be the best use of that patient, and it might create some potential redundancies or work that could be done by someone else, because we want to make sure that if you can delegate any responsibilities or ensure that other team members are working on it, we need to do that. Now again, the workflows for each of your practices are going to be a little bit different. Now we're going to talk about a few things later today that hopefully will help with that, and then in the well visit toolkit are some examples of how to be successful from a small practice to a large multi-specialty group. The more we can minimize redundancy, the better. And that's everything from, if we're documenting something on paper, do we need to convert it over into the EMR? If something's already being documented or captured once, do we need to repeat it? The more we can minimize redundancy and extra effort, extra time associated with the well visit, the more it's going to position, or the better it's going to position ourselves to maybe see one more patient for one more well visit and spend less time doing administrative tasks in the background. And I love this idea of saying that we're going to focus on the patient. And focusing on the patient from a well visit perspective is important because we need to think about that one patient that's in front of us in the moment for the well visit, but we also really need to make sure that we're thinking about our whole population. So not just on the patient, but the patients. Because if we're having one provider take an hour with one patient, now that's potentially 4 or 5 other patients that were not able to be seen by that same provider. So how can we best identify our workflows that allow team members to be shared, responsibility to be shared, to maximize our effort so that we're able to see not only those sick patients that we have to see right away, but see those well visits and be able to plug them in and best coordinate that visit. So by far one of the most important parts of establishing your well visit program for yourself, and when I say well visit program, I'm saying let's go beyond trying to get to 20 to 40 to 50%. How do we make sure that we're able to get to 60, 70, 80, 90% for our well visit completion rate? And that's going to start with some of those frontline team members, and that's going to be how can we best make sure that we're giving that help, that HRA out to every patient, ideally in the lobby or in some way that we're able to do it as effectively as possible. And making sure that that patient is educated, but also that that registration team member is educated. And again, I'm going to reference back to on that well visit toolkit, there's a section that talks about patient or how to best educate or best approach this with our patients, because it's important for every team member to understand that this is not a physical. So that way they can best approach a patient and say that this is not a physical, you shouldn't be expecting labs or imaging. But the more we can get done by the registration team member before the patient starts, the more successful we're going to be. And that may involve, as a patient checks in, if it's just for a 6 or 3 month follow-up, can we get that patient converted over that day for an annual wellness visit? Now, we had somebody on yesterday's call that spoke up and said now they try and always make sure that they either do the well visit or they try and do the well visit and whatever the patient was coming in for in that day. Now, I would encourage you to really take advantage of ACO Health Solutions. That's going to be one of your best resources for identifying which patients are due for a well visit. Now, I'm expecting kind of any day now we should have a refresher in that data so that we'll be able to show information through mid-March, because I know we're kind of at the very tail end of when our information is most useful for us. But the more proactive we can be with our scheduling, so when a patient is checking in, maybe the registration team member knows that they can't fit them in that day, but they approach the patient and say, can we get you to come back in 3 months, 6 months, maybe even next week, for this free visit that will allow a personalized prevention plan to be developed by your provider. So the more we can be proactive in trying to get those patients scheduled for future exams, the better. And then I know for many of you, the same person that's checking in patients is going to be the person that's scheduling patients. For a few of you, you might even think of a scheduler as being a separate department. I know when I'm thinking about the roles and responsibilities, I might think of people as, or responsibilities as separate people, and the scheduler is the one that if I'm thinking about as a separate person, it's not the most exciting portrayal, but I tend to think of the scheduler as the person that sits in the back room or kind of a back windowless room and just spends all of their time reaching out to patients. So for that scheduler, they need to make sure that they're proactively going through patients that are already scheduled and trying to identify those that they can convert over to well visits. Reaching out to the patient and contacting that patient to say, can we get you scheduled, either for the ones that are already scheduled or for those healthy patients that maybe just don't have an appointment quite scheduled yet. We need to get those scheduled. And this is going to be the component that will take us from going from 20, 30, 40, 50% completion on our well visits to 60, 70, 80%. And something I heard from a team member in Utah on Monday was that one of the things for them that's made a huge difference is when they're having a scheduler reach out to patients, they don't say, I'm Adam, I'm calling from Dr. Smith's, or I'm Adam, I'm calling from the practice, or I'm calling from the clinic. I would say, Dr. Smith, hi, this is Adam. Dr. Smith approached me and said he wanted to make sure that you came in for your annual wellness visit. And Dr. Smith wants to make sure that you come in and we get this taken care of. And a well visit is going to make sure that you're doing okay. Then we have that personalized prevention plan developed for you for the year. Now we're going to go through a couple screening things, and it's really designed to make sure that you're able to be as successful as possible. And this is something Dr. Smith is a really big advocate for. Do you think we can get you in taking that approach as opposed to, I'm Adam, I'm calling from the regional practice. I'd like to get you scheduled for a well visit. Well, it's going to be important. We're going to do some screenings, and there's no charge. So the more we can better or kind of best connect that appointment itself to the provider, the easier it's going to be to get our patients to come in, the easier it's going to be to sell that visit to our patient to get them engaged. And then I would say for each of you, you're going to need to understand your own schedule and identify what's the best way to make sure that we're scheduling these well visits, but not over-scheduling ourselves. And if we overschedule ourselves, we might create a kind of weird environment where we're not able to give the most effort to our patients, and that's going to go back to the idea of how can we best share work, how can we make sure that our workflows are maximized, but then also how can we make sure that we're positioning ourselves and our patients to be successful by appropriately scheduling our visits. Now that's going to be the type of thing where you might want to look at your schedule and say, if we have 800 attributed patients, well, we know that if we're going to try and get through 80 or 90% of these well visits for the whole year, we're probably going to need to do about 15 to 20 a week. Well, if we're going to do 15 to 20 a week, how can we best balance that work? Is that doing 3 or 4 a day? Is that maybe taking a couple days and trying to do 6 or 8 of them? We need to make sure that we're able to best balance that workflow and those expectations out for ourselves. And then that correlates really well into the clinic responsibilities. When I think of clinical responsibilities, I'm thinking of the actual visit itself. So now that we've got that HRA completed, how can we make sure that we're being as successful as possible in the visit? Now, I referenced at the start that top of capacity, top of licensure. We need to make sure that we're taking advantage of every team member that can be associated with the well visit. We need to make sure that we're really designing our EMR to capture information ideally once that we can use multiple times. And when I say use multiple times, it's going to be important that we're using some of those codes that we can help to make sure that we're documenting those mammograms, documenting those fall risk assessments, documenting those depression screens. If we can document in a way through our EMR that will allow us to capture that information, it's going to make our quality audit much easier for ourselves. And we really need to think about, as we're going through the visit, because we want to make sure that we're not doing something twice, how can we best make sure that we're taking advantage of that gaps in care report within ACO Health Solutions to really focus on closing any of those gaps in care in our patients. Now again, a gap in care is not to say that something wasn't done or in any way bad care was provided. A gap in care is just, something happened that we don't quite know about it, or we don't know if it was done yet. So a patient might have had a colonoscopy, but if we don't have documentation that says it was done, it's really hard for us to justify to CMS or to justify even to ourselves as we're making sure that we don't miss anything, that we have everybody complete. And the better documenters we can be, the more successful we're going to be from a quality audit as well as just tracking our progress over the year perspective. It's going to make it easier to say, in October we really need to do a hard push for mammograms because we know that everybody's been appropriately documenting for potential mammogram use over the course of the year. So the actual well visit itself, I'll pause here. Any questions up to this point? Okay. So the actual well visit itself is a pretty standardized visit. Now there's a couple different variations and things that we can try and add or wrinkles that we can promote, but I would say the well visit on its own is a list of components that we need to make sure we touch on, and that's doing the mini mental exam, doing the depression screen, doing the health risk assessment, checking a blood pressure, checking a BMI, and developing that personalized prevention plan. Now you can always do more than that, but you may not be paid for doing more than that. But we always want to make sure that we identify best workflows for being successful. So now we're going to go into a couple things that, even though this is a pretty standardized visit, how can we maybe have some adoptions or variations to this that'll best support our patients and best support our well visit program. So one of the questions that we get asked quite a bit, and it goes back to that proactive scheduling, is can you do a well visit and an E&M or a sick visit at the same time? Absolutely you can. So if you have a patient comes in and they are concerned about maybe a little bit of a sore throat, but they also are due for their well visit. Now if you have time in the day, you can absolutely do both the well visit as well as the sick visit or that 99213, 214 E&M visit. And by doing both visits at the same time, we're able to kind of check that box. So we've gotten our well visit done for the year and captured not only our quality information, but developed that personalized prevention plan for each of our patients. But we've also kind of positioned ourselves to essentially get paid for 2 separate visits. So by using that 25 modifier, or modifier 25, depending on the terminology you prefer, we can get 100% reimbursed for that well visit. So if it's again about 110 to 15 if it's a subsequent, or about 165 or 170 for an initial annual wellness visit, as well as the revenue generated from the 99213, 214, 215. So we would get paid 100% from Medicare for the well visit, but for any of those E&M or those follow-up visits, there would still be a patient copayment associated with it. Now that's also going to happen if we're ordering any labs or any imaging as part of our well visit. It's just important to keep that in mind of the well visit reimbursement at 100%, that covers the well visit. That doesn't cover other things that you as a provider might be doing to go above and beyond. Advanced care planning is a service that is Imperium Health we really love and we really promote. It's the idea of let's start to have those end-of-life discussions with our patients a little bit sooner. And I think this is important because too often we don't have that conversation either internally with our amongst our family members or with our providers a little bit earlier. Now I think of this as it could be important for everyone. I know for me as a young man it's important because what if I find myself in a near fender bender and you kind of have that life flash before your eyes type scary moment of you almost got in a car accident. Now that could be the type of thing that even though if my doctor said, have you thought about end-of-life care yet? And I might be kind of brutish and say, I don't think I want to have that conversation quite yet. But if I would have had that conversation, or maybe even approaching the idea of having that conversation, when I have that near fender bender, or grandma or grandpa almost fall in the shower, that could really spark that, I'm glad I had that conversation because I feel a little bit more secure. So advanced care planning is it's intended to be a 30-minute discussion about end-of-life care. Advanced directives are important, but you don't necessarily have to only talk about advanced directives, or you don't necessarily have to talk about advanced directives. It's about what would you like for the end of your life. Now, if you're doing an advanced care planning discussion associated with a well visit, there's no copayment to the patient. So again, I said it's 30 minutes, and by CMS rules and regulations, it needs to be at least half of that, or more than half of that defined time. So it needs to be at least 16 minutes of documented discussion between the provider or the staff and the patient or the patient's family members. So again, it could be a provider starts the conversation and then they hand the patient off to an MA or to a nurse and they finish the conversation. So if we're doing the 99497, that advanced care planning, along with the annual wellness visit, we're going to use a modifier 33, and that's the best way to make sure that a patient does not have a copayment with it. Well, this isn't necessarily required. I would say this is a good practice, and one that for many of you, you're probably having those conversations today already, and this is a great way to make sure that we're getting that extra $80 that we could be paid for this service by billing for that 99497. Now if you're billing for this 99497 not as part of a well visit, there will be a copayment for the patient, just the same way if you were doing a lab test, imaging test, or a 99214 clinic visit. So one of the tougher scenarios in which we often run into is a patient expects a physical, and a well visit is not a physical. Now these are scenarios in which we've came across and we've seen practices incorporate into their workflows. It's not necessarily to say that either of these is a best practice or something that you should do, but I like to bring these up because they both may fit with how you can best satisfy those patient needs. So if you have a patient that feels like I need this physical, I've come to expect this physical. And oftentimes a Medicare Advantage plan will pay for a physical. So for our traditional Medicare, how can we best incorporate the idea of a physical that a patient feels that they're expecting into a well visit? Now one of the things that we can do is maybe just do a separate visit. So a patient comes in and does their quote-unquote physical, and they do that maybe a week before their actual annual wellness visit. And by coming in a week before, then maybe we do the labs, do the imaging, and document a few of those other things that the patient is coming to expect. And then a week later, the patient comes back and they do their annual wellness visit. So, and not only would they be reviewing that health risk assessment, the depression screen, and all of those other components, but they would be maybe also reviewing that chest x-ray, that preventative chest x-ray, or those preventative lab tests that the patient felt that they wanted. Now any labs or imaging tests that you would order, they would need to be medically appropriate, and that would fall under kind of the same If you were going to do it on an outpatient basis in your clinic, it would need to be approved by CMS. But that's one scenario. If you're doing that quote-unquote physical, and again, Medicare does not pay for a true physical, so it's how can we best sort of adapt and adopt things that might best fit us. That's one way we could potentially do it. Another way in which I've seen this done is to do what I'm going to call an ACO visit. So for this ACO visit, we're going to do it probably 6 months after our well visit. And we're going to do our well visit in, say, January or February. And it's the traditional, what is an annual wellness visit actually meant to accomplish? We're going to do our HRA, we're going to do the depression screen, we're going to get those core components done. And then maybe 6 months later, when a patient comes back for their ACO visit, we're going to pull up that ACO Health Solutions Gaps in Care report. We're going to review that, and if there's any things that are outstanding on our patients and we need to make sure we're closing those measures, we review that. And then if the patient wanted that lab and preventative imaging done, we can do that as well. And maybe tie that into a second visit. Now again, for that second visit or that ACO visit, there would be patient co-payments, and that would fall just like any other visit. But that's a way to make sure that not only are we closing those ACO gaps in care and those quality measures to make sure that we're best satisfying the information, but we're also providing that quote-unquote physical that our patients may come to expect. So another variation that we came across that I'm a big fan of in the right situation is, if you have a practice where you feel like our providers are stretched to the bone and we know that they are essentially booked out for a couple months and there's no way we can add one more preventative or well visit to their plate, you may want to consider having an LPN or an RN do the visit as a essentially extension of the provider. Now, one of the unique things and really neat things about the annual wellness visit program is that you can do a well visit as long as you're a traditional fee-for-service clinic and not a rural health clinic or a federally qualified health center. You can have that visit performed under direct supervision of the physician by a licensed clinical professional. A licensed clinical professional, from everything I've read and came across, was that it should really be an LPN, RN, or maybe start thinking about a health educator, registered dietitian, or a nurse nutritional professional. So somebody that has to be licensed by the state of Utah. And by being able to delegate some of those things, it can create an opportunity where we're able to best share the work. This is great if you have maybe an open exam room and you're not fully utilizing it, or if you have a day when maybe one of your providers likes to go home every Tuesday at noon so that he can go golf in the afternoon. Well, now we have a team member that wants to get their hours, and we have an open exam room because we don't have a provider. So we can schedule those visits, those annual wellness visits with that nurse for that afternoon when there's no one using that exam room anyway. And that's a great way to really play up the role of an educator and build off some of those strengths that a nurse already has. I've seen this be very successful in multiple states with multiple ACOs, and this can be one of the best ways to not only increase revenue, improve the morale of your team members because they get to expand some of their roles and the duties that they normally do, and almost get to function as a health educator in a way that they don't normally do on their day-to-day activities. But it's also really going to make sure that we're best connecting with our patients and letting our patients know how capable all of our team members are. So billing is so core to a successful annual wellness visit program. And I would say making sure that you're taking advantage of all three codes is essential. And I would say if you're skipping out on that IPPE visit, not trying to catch those patients proactively, that's going to be a real potential missed opportunity. We need to be getting those in as often as possible to best take advantage of all three visits. So again, the IPPE is going to pay about $170. The initial annual wellness visit is going to pay about $170, and the subsequent annual wellness visit is going to pay about $110 to $115. So if we can make sure that we're capturing all three, it's going to be one of the best ways for our practice to make sure that we're getting, over the course of our annual wellness visit program for each patient, an extra $50. Because otherwise we end up doing a 438 and 2439, so we're going to end up missing about $50 or $60. For an FQHC, I don't believe we have any FQHCs. You're going to do a G0468 for the visit, and then you're also going to, as your PPS qualifying visit, and then you're going to use one of these other 3 visits as your actual wellness visit. So it's important to make sure that we are identifying workflows, establishing processes that make sense. But monitoring performance over time is the difference of going from kind of good to pretty good to really, really good and good to great. So I would say for somebody in the background, they do have a little bit of beeping. It almost sounds like an alarm of some sort. It almost kind of reminds me of a fall risk alarm that might be going off in a hospital. The annual wellness visit program is something that it is easy to say we're doing, but it's sometimes hard to know how good we are at doing it. And I would say setting goals associated with your well visit is one of the best ways to be successful. I'm a big fan of the phrase, you measure what matters. And I would say the more well visits we're doing, the better it's going to position ourselves to be successful on the ACO quality audit. So a good goal that I have for just about every single practice is to try and get at least 80% of their patients in for a well visit. Now we know that 80% I feel like is an obtainable target because there's going to be some patients that have become attributed to us that maybe have moved away. Maybe we saw them once or twice in a setting, but they're no longer with us. Or there might be patients that show up on an initial list that happen to have passed away. So saying 80% I feel like is obtainable because it hopefully allows that we're able to get as many of them in as possible, but a couple of them we just know that we're not going to be able to get in. And I would say setting that goal and promoting it is one of the best ways to make sure that we are staying on top of and never missing out on those opportunities for ourselves. And the best way to do this is going to be to take advantage of ACO Health Solutions, take advantage of any reports that are available, and kind of brag if you have a provider or a practice that's doing really well. If you have maybe a physician that's struggling and just not buying in quite the same way you need them to, but you have a couple nurse practitioners that have gotten very excited. And for one of our ACOs that we work with, we ran into this scenario last week, where they have a physician that's being just a little bit stubborn about doing their well visits, but they have a couple of mid-levels that are really excited. So my suggestion to their CEO was, build off the success that the nurse practitioners are having already. Promote it to the whole team. The more we can promote the successes that we're having, the better we're going to be. The more we can take advantage of ACO Health Solutions to identify which patients are potentially available, the more likely we're going to be able to continue and sustain that success over time. I would always make sure that we're promoting doing a periodic audit. The more that we can go back and make sure that we're validating that our information is being successful, or everything is being paid the way we expected it to, the better. I hate for anyone's claims to be held up because a coder didn't understand the code, especially if you're using an outside coding agency that may not fully appreciate the nuances of the annual wellness visit. Or I'd really hate for anyone to get an annual wellness visit claim denied because they added a depression screen or something that was a revenue generating code that just is not allowed to be paid at the same time. So the biggest red flag I'd say paying attention to there is make sure that you don't use the G0444 code at the same time as a well visit, because that will likely get denied. Monitoring your performance on a week-over-week basis is going to be one of the best ways to make sure that you're always staying on top of it. Now, when we get claims, we're going to get claims on a monthly basis. And when we get those claims, they're always going to be a little bit old. But one of the things that you can do for yourself is if you're keeping track of as a leader or as an ACO lead, how many did we do this week? You're going to best position yourself to make sure that you're never surprised by claims. I would say that of the practices that have been most aggressive about or most assertive about monitoring their performance over time, those are the ones that have the best understanding of the importance of the claims data and how to be best proactive, or how to be most proactive about that approach to their annual wellness visit program. So, and I touched on a second ago, promote anything that's going well. If you have a week where you did the most well visits you've ever done, let every team member know. Have those small celebrations. The more we can celebrate small wins or small successes that we're having along the way, the better. And again, if you're having one pod or one provider that's being really successful, promote it. Absolutely promote it. One of our centers has the the highest TCM rate, actually highest TCM rate of all of the Imperium clinics that we work with. So we made sure to let Southwest Internal Medicine that from a TCM perspective, they actually have the highest TCM rate of any of our practices that we work with. Now for well visits, I look forward to the point where we're going to be able to point one of you out and hold one of you up as saying that you have the highest well visit completion rate or highest performance of any of the Imperium ACOs we work with. And internally, you need to do the same thing. Say we're doing more than last year, we're doing more than we did last month. That's a success. Appreciate those small wins here and there and really promote that success. Now when we got done with our last well visit presentation, one of the things, and that was well visit and TCM, so there was a couple different boxes that were up here. We talked about the things that you need to do to establish your program. And that's making sure that we have our EMR in place, that we've educated our team members. And again, educating a team member, that goes everywhere, everything from a scheduler and a registration, MA, clinic manager, to your physicians and all of your providers, because everyone needs to understand how important these are. Making sure that our coding and billing are being done correctly every time. Having our schedulers really start to think about how can we be proactive about scheduling these patients. So those are the things that I'm thinking about establishing a well visit kind of routine I would want to be paying attention to. But if I'm then starting to think about turning that routine or doing a number of these things into a full-on program and a really successful program, the things I want to be thinking about next are, have I adequately, really tried to map out how can we best share responsibilities within the team? And I know for some of you that's going to be easier than others, but how can we best share that responsibility? Have we established goals for ourselves? Again, if our goal is to get 80% done and we have 800 patients attributed to our practice, we might need to get 15 to 20 done every week. So knowing that we need to get 15 or 20 done every week, how can we make sure that we're setting those small goals up for ourselves so we can celebrate those small successes every step along the way? Now, if something seems like it's not quite right, have we maybe tried to do modifications or put an improvement plan in place? And then I would say, when you really get to be high functioning, taking advantage of ACO Health Solutions to be really selective about which measures are we most focused on for certain patients. Obviously for a man, you wouldn't worry about their mammogram. If a woman is over 75, you wouldn't worry about her mammogram either. If someone is less than 65, we wouldn't be quite as concerned about their pneumonia vaccination. And ACO Health Solutions is going to be one of the best ways to have that visual cue or visual flag for ourselves to know who should we best focus on by using that gaps in care report. Again, that's updated on a monthly basis at the same time that the reports and other claims information is available to us. So I would say that for those of you on the phone, this would be the kind of next best thing for yourself, is not only make sure that with those things on the left that we've checked those boxes and we're yes to all those, but now we're starting to think about maximizing it, and the things that are on the right, how can we be most successful there? That's it for what I have prepared for you today. Is there any questions or things that you guys wanted to talk through, or might be different than you've heard in the past, or questions on how you can take something and best adopt it to your own practice? Carrie asked difference between G codes and F codes. Carrie, I would say that the F codes tend to be a little bit more procedural, and those tend to be a way to use an action that we did that's usually a non-revenue code to capture information. So I would take advantage of, within that annual wellness visit toolkit, the coding for quality slides, and that has some CPT2 and G codes that are going to be very good for capturing and monitoring our quality performance over the course of the year.